This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. I'm Kyle Wiggs. We've got three different guests here. We're going to spread them out through the course of the program this morning. The focus of the program, breast cancer. October is Breast Cancer Awareness Month. So let's start with Dr. Ihtishaam Qazi, and he's first up here on Mon Health Talk. And Dr. Qazi, thanks for your time this morning. We appreciate it. Good morning.
Good morning. How are you?
I'm doing well. As we mentioned, October is Breast Cancer Awareness Month. So we're talking specifically about what women can do. Obviously, prevention is the biggest key. So let's start with some basics. How common is this among women, particularly in West Virginia?
So, the national numbers that are out there usually show about 1 in 8 women will be diagnosed with breast cancer during their lifetime. And in West Virginia, we have probably just a slightly higher rate than that even. And that's a really stark number. And here, this is where prevention really, is key, is that, when found in an early stage, the 5-year survival rate is like kind of how we track the treatability of these cancers. The 5-year survival rate is over 99%. So really important to get people screened and find this early.
Yeah, so it's highly treatable when it is detected and the treatment is started early, correct?
Yes, that is absolutely correct.
Okay, so what about the screening? And have the screening guidelines changed, let's say, in the last 10 or 15 years?
Yeah, this is the big point that we try to get across. I think most people out there, they think that this is a cancer of older women, and it is true. But a lot of these cases that we see are younger women. So now the screening guidelines, there's some variances in how some of the organizations do it, but most will recommend that at age 40 that women do annual mammograms. But, people who have a little higher risk, whether it be, family history of female cancers, breast or ovarian cancer, that they, should probably start earlier. And that's a kind of a very important discussion to have with your doctor about when you should start screening based on those risk factors.
Okay. Is this type of cancer being detected earlier in women? Is it something that's afflicting younger women? And why do you think that is?
Yeah, we definitely see that in our clinic and on our tumor boards. We're seeing that there are a lot of younger women getting afflicted, and the issue there is probably what we see with a lot of other cancers too, like colorectal cancer, that there's probably just more exposures to different carcinogens, in the environment, and that's what's really driving these cancers, because they're not just the typical type of hormone-positive breast cancer that you see in older women. So it's so important for women in the younger ages. Our mothers and sisters and all the females in our lives. They take care of everyone else first, and then they take care of themselves last. And that's we gotta make sure that they get their care needed, because they're such an important part of everyone's life.
Yeah. What are the biggest factors? Is family history perhaps the biggest factor?
So that's actually a common misconception. I would say, more than 95% of all the cancers that we see have no family history of breast cancer, and so risk factors that we do know of, obesity, alcohol use, lack of exercise, they can contribute. Some issues in older life when depending on when and if the lady has had children. That can also affect their risk. But, most of that risk can be mitigated by just early screening.
Mm-hmm. Okay, so mammograms are the way that early cancer is detected. So when you look at a mammogram and you see something that maybe causes you concern, what's the next step? Where do you go from there?
Yeah, so it's a very good question because most women who are getting their screenings, they at some point some of them will be called back, and an abnormal mammogram does not mean that it is cancer. It just means that something looks different and it needs a closer look. This could be a shadow, a lump, calcifications, even overlapping tissue. So it's about 80% of those people who are called back turn out to be benign reasons, but again, essential to follow up. And, at Mon Health, we are so fortunate. We have several dedicated breast radiologists. One is Dr. Ginger Lane. She is just an amazing physician and really has really put a dent in finding these cancers and really reassuring patients, really hand-holding them through that process, which is so important, especially in that scary time between what we call an abnormal mammogram, to a biopsy to confirm what it is or is not.
Okay, so you see something on the mammogram and you look at that, something abnormal. How many of those end up being biopsied, and what is that procedure like?
Yeah, so again, like I said, from the screening mammogram, we'll go ahead and they do what we call a diagnostic mammogram, and then most likely an ultrasound as well. And again, 80% of those turn out to be benign, and a small percentage of those, maybe 20 or so might get biopsied. And the biopsy itself can be done by these amazing radiologists. They actually can do those biopsies, and then it's just a matter of then following up with that result after the pathologist has taken a look at it and try to characterize what that abnormality is, whether it be cancer or even still it may not be even cancer. And there's a lot of benign pathologies out there. Again, that's why we're fortunate to have such a wonderful team for breast cancer care at Mon General.
Mm-hmm. Last thing for you, doctor, if someone's out there listening and depending on their age, how would you encourage them? What would you say to encourage them to get checked out and to, again, as you mentioned before, the survivability rates, if it's caught early, are very, very high. It can be treated, but the first step is go in and get checked out, right?
Right. I got into oncology because, it was a fascinating field and we were making so many strides every single day. It's just amazing to me, where we are and how many cancers we are, curing and effectively curing that, were deemed incurable even years ago. However, for all that we do in treatment, there's nothing, even comparable to just finding these cancers early, cutting them out. I can't tell you, more than enough. Most women don't actually, although we recommend self-breast exams, most women don't find these. They are found by the mammogram itself. And so that's why we've seen such an increase in survival from breast cancer. And it's so important, just so important. It's so much easier to treat these when they're early on rather than let them to grow and spread. And so it's just, there's just such an emphasis here on getting those screening mammograms, as well as, all other screening, like screening, colonoscopies for colorectal cancer. Those screenings just really, they save lives, they save the quality of your life, and just so important to do.
Very good. Dr. Ihtishaam Qazi with us. It is October is Breast Cancer Awareness Month. And, Doctor, thanks for your information. We're going to talk with Kathlene here and also Tricia Julian coming up on the program. Again, Doctor, great information. We appreciate your time.
Thank you for having me.
All right, Dr. Qazi there on Mon Health Talk. We'll take a break and return. We'll continue the conversation on WAJR coming up after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk continuing for this Monday. Thanks for joining us here on WAJR. Again, October is Breast Cancer Awareness Month, and we're going to spend some time here with Kathlene Jurczak. She's breast health nurse navigator, And first of all, Kathlene, good morning. Thanks for coming on.
Good morning.
Tell us your role. What's your role in this process?
My role here is breast cancer nurse navigator. I work along with the staff here, following mammograms, getting patients scheduled for any additional imaging, or getting patients scheduled for biopsies that they may need to promote an earlier diagnosis if needed.
Mm-hmm. Okay, so you come in after the mammogram is read, and maybe there's an abnormality on there, but that could, as Dr. Qazi just shared with us, that could mean many, many different things.
So if a patient comes in for their screening mammogram, one option is they may need to come in for additional imaging, which would be spot compressions or an ultrasound. So I work along with the mammogram techs to get that patient scheduled for that. Or if there is a biopsy recommended, I kind of follow up with their providers to make sure that we're getting orders and that the patient's getting scheduled in a quickly manner.
Okay. Again, each of the mammograms is assigned a RAD score. So can you explain what that is exactly?
Basically, a RAD score is a way that the radiologist reads it to determine what the patient needs next in that realm of care. Like if a patient comes back and it's a BI-RAD 0, that basically tells us that the patient needs to come in for imaging. And then if it's a BI-RAD 4, that's usually where they indicate that we need a biopsy.
Mm-hmm. Okay, so if an indication is made that a biopsy is needed, that obviously kind of heightens the anxiety level and, gives you a little bit of cause of concern. So what happens after that? I know you like to try to minimize the time there so the patient isn't left wandering.
So what happens after that is the patient's made aware that they need a biopsy, and I work hand in hand with their ordering provider and get those orders. And then I kind of reach out to the patient and try to get them scheduled as quickly as we can. Our current scheduling has been less than 10 days here at Mon. It's one of the quicker turnover times here in the region. And when I get orders, I call the patient and I talk to the patient, kind of try to decrease the anxiety by explaining them what to expect. Mm-hmm. And then if it does come back a positive pathology, then I reach out to the patient and kind of give them just general information of what to expect on their journey here and kind of follow them through that process.
Yeah, and the support is very, very crucial at this point, right? Because they've received some bad news. So what do you do to try to ease them into the next step?
I just try to encourage them that I'm here. I give them my number. They can reach me at any time. I try to keep them in the game as to what to expect so the uncertainty doesn't heighten that anxiety anymore. But I also try to provide as much emotional support as I can. I make myself available for them and their families if needed. And I just encourage, the proper means of follow-up that they need to help decrease that anxiety.
Very well. Again, we asked Dr. Qazi this. I'll ask you this question: if someone's listening and how would you encourage them to try to get out in front of this? Right, the earlier, if you have a problem, the earlier it is detected, the more treatable it is.
I would definitely recommend their annual screening mammograms. Don't wait.
Mm-hmm. Very good.
The sooner you get in, the sooner you get a mammogram and it has any abnormalities, the sooner we can get you in and find out definitely what's going on there and get you, through that process if anything needs done, get you in the door quicker, better sooner than later as far as diagnosis is concerned with treatment.
Absolutely. And again, the website is monhealth.com and the number 304-598-6560. Kathlene Jurczak's been with us, breast health nurse navigator. Kathlene, thanks for your input. Thanks for your time, and we really appreciate it.
Thank you.
We will take another quick break. Tricia Julian, oncology nurse navigator. She's scheduled to join us next. Stay with us. Mon Health Talk will continue on this Monday morning, right after this.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Mon Health Talk continuing on this Monday, October Breast Cancer Awareness Month. And with us now is Tricia Julian, oncology nurse navigator. And Tricia, good morning. Welcome back to Mon Health Talk.
Good morning, Kyle. Glad to be here.
Thanks for your time. Okay, so we've talked with Dr. Qazi. We've talked about Kathlene. We've gone through the process of the mammogram and reading the mammogram and perhaps going through the biopsy situation. And I'd like to talk to you about what happens to a patient after the breast cancer diagnosis and what's available in terms of support there at Mon Health for these individuals.
Okay, so after someone is diagnosed, then the process is that they will see the medical oncologist, which would be Dr. Qazi or one of our other medical oncologists, and the patient will enter into an appropriate treatment for them. And the important part of my job, I feel, is that the care doesn't stop when the patient finishes that treatment. We have comprehensive support for patients throughout the trajectory of their illness. So a large part of my job, in addition to education for patients during their treatment, is what happens after they finish their treatment into survivorship. And we have a lot of different programs. We have wig banks and bra banks. We've got a lot of other support programs. We have a great series going right now called PB&J, which stands for Positivity, Balance, and Joy, and that brings survivors together for, in a lot of cases, just a relaxing social activity. But in addition to that, we talk to them about any issues that are bothering them, steer them in the direction of any other services that they might need. We have an event coming up on Tuesday, October 28th, which is a water aerobics class that will be held at HealthWorks. It's at 6 p.m., and anyone who would like to attend that can get hold of me here at the hospital at 285-2690. So those are just some of the things that transpire after a patient has finished their treatment.
Mm-hmm. All right, so support and really kind of companionship, that's what it's all about.
Absolutely, yes. I heard from one of the patients who was coming back for another session who told me that the people who come to these sessions on a regular basis are her tribe. So I was really touched by that, and I think it's really indicative of the kind of relationships that those patients have formed with each other.
Mm-hmm. The PB&J series, I know we've talked a lot about that from you and from the HealthWorks point of view as well. What about the Living Beyond Breast Cancer program? Can you tell us more about that?
The Living Beyond Breast Cancer is another form of survivorship support. They're just a great organization, and what we've done in conjunction with them is I went to Philadelphia and did some training with them, and then came back and along with Dr. McBee's nurse practitioners, we did a couple of sessions on sexuality and cancer, because that's an area that can be truly, truly impacted, especially with breast cancer patients, and particularly in the younger breast cancer patients, the 30 and 40-year-olds that are affected by breast cancer. So it's a great program as well.
Mm-hmm. And all of this available through the Mon Health system. And again, you can reach Tricia at 285-2690. Again, the PB&J series has been very, very successful, and I know you talk about the session coming up, the water aerobics, on October 28th. Anything planned beyond that at this point?
Yes, we have another session in November that will be on Tuesday, November 18th, and that's a service project that we're doing. I think this just shows the depth of the feelings that these patients have that attend these sessions. They wanted to do something for other patients, and so we're doing a service project at that particular one where we're going to put together an activities card for our infusion center, which will have things like Sudoku books and puzzle books and coloring books and different things that patients can do while they're getting treatment here at the hospital.
Mm-hmm. And one thing about these types of projects, again, you mentioned the one lady calling it her tribe. It gives people a support group that's kind of built in there, and everyone helps everyone else along.
It certainly does. And some of the other things that we've done is teach them how to deal with stress, both during treatment and following treatment, because in some cases, the time following treatment can be a very, very emotional and traumatic time, because you're waiting for your scans to come back. You're waiting for all of these other things that are measuring what your progress has been to come back. So, yeah.
Yeah, very good. Well, Tricia, we appreciate your time. Thanks for all the great work that you and your staff do, and I'm sure we'll continue to highlight these activities in future programs. Thanks again. We appreciate it.
Sure thing, Kyle. Thank you.
All right, Tricia Julian there, oncology nurse navigator with the Mon Health System. That's Mon Health Talk for this Monday. Thanks for joining us.